about squaring of the pelvis. That is, when to do the squaring of the pelvis and why do you want to do the squaring of the pelvis. Here I am trying to demonstrate in animation how to do a squaring of the pelvis. Here you have a normal pelvis when both lower limbs are parallel to each other. You imagine a situation where there is an abduction deformity on the right side, for example. So the anterior iliac spine, anterior superior iliac spine is at a lower level compared to the normal side that's on the left side. So there is no problem in the left hip joint. In this case, both limbs are not parallel to each other, they are divergent. For a person to propel forwards, you should always have both lower limbs parallel to each other. It is then when we square the pelvis to exactly bring the pelvis horizontal to the lower limb or to the couch. For that, we need to know the prerequisites to square the pelvis. So there are three areas. Number one, at the hip joint level, there should be a pathology in the hip joint, that's intra-articular pathology in the hip joint, of inflammatory in nature or infective in nature, wherein you should be able to move the trunk with the movement of the lower limb. That means lower limb and pelvis act as a single unit because of the inflammatory and infective pathology inside the hip joint. Second one is there should not be any problem in the lumbosacral junction. The junction should be normal. The third one is there shouldn't be any organic pathology. For example, the pelvis is of rachitic type following rickets or following trauma. You cannot really square the pelvis. So the deformity is not concealed, it's always revealed in organic pathology. If you observe here, both lower limbs are parallel to each other. You can propel forwards. There is a coronal deformity. And then we take measurements, we call them as apparent measurements from the sternum to the medial malleus on both sides. Here the patient can propel forwards because both lower limbs are parallel to each other. But when you want to take real measurements, that's why we square the pelvis. That means we square the pelvis to measure the real leg distancy of the pelvis. So how does it happen? So we try to excite a deformity on the disease side, that means you produce more abduction on the right side. Both anterior superior iliac spines are at the same level. We also keep the normal limb in the identical position of the abnormal limb or diseased limb. That much of abduction is to be maintained. And you take measurements from both anterior superior iliac spine to the medial malleoli. That gives exactly the true measurements. This is the reason why we always do the squaring of the pelvis to take true measurements. Don't get confused with the movements of the hip joint before squaring of the pelvis or after squaring of the pelvis. Normally, squaring of the pelvis is classically described to know the true measurements of the hip joint during the examination of the hip joint. All the best, students.